They say friendships are formed by being at the right place at the right time, a circumstance that happens to us, a sheer coincidence. But I don't think that's the case. People come into our lives for a reason, for a purpose that is much larger than we know or are able to see. Friendships are the essence of connection. They are the links that make us stronger as individuals and collectively together. Yet it's how we choose to build those friendships, those relationships and bonds that can prosper into something incredibly special over the course of time. My name is Roger Brooks. I do not take friendships lightly. I have made many friends over the course of my lifetime, some more recent, but many that date back to my childhood and high school years. As part of my mission to raise global consciousness, I'll be sharing many of my friends' stories with you here. How could I not? These incredible people have not only made a profound impact on my life, but they are making an impact on countless others, and in the process, are changing the world. Their stories will challenge you and your thoughts and will make you look deep within yourself, which just may empower you to make modifications in your own life and a difference in the lives of those around you. What started out as a hobby has quickly turned into my life mission. Join me on this journey to help make the world a better place.
Diabetes kills more people than cancer does because it affects every system in the body. It can affect every part of your body, but it takes time for those complications to occur. 2030, 1 out of every 4 people in the world are going to be diabetic. Those numbers will be here in this country in 2050. Doc, I'm not diabetic, I can take a pill, or I can eat what I want, I can take a shot. If you continue with that logic, I will be cutting something off of you. Diabetes is an equal opportunity destroyer. It doesn't care what your gender is, it doesn't care what your race is, it doesn't care how wealthy you are, it doesn't care how poor you are. So diabetes is a destroyer. But I think if we as advocates can get out there and get people to understand, if we just exercise a little bit more and we eat better, we can get rid of half of the diabetes that is going on now.
This week on American Real, we bring you Dr. Matthew Regulski, foot and ankle surgeon who specializes in diabetic reconstructive surgery, limb salvage, and wound healing. Describing the worldwide lack of interest and concern over the disease, Dr. Regulski coined the term diabetic apathy and discusses if the trends continue by the year 2030, 1 out of every 4 people in the world will be diagnosed with some form of diabetes. As an advocate of the American Diabetes Association, his mission is to continue to spread the word about the disease, which he feels most patients still underestimate the destruction diabetes plays within their bodies as a silent killer. Dr. Regulski goes on to explain how diabetes affects every system in the body, yet it takes time for complications to occur. Tune in to this episode as it will open your eyes to the truths about diabetes, an equal opportunity destroyer. Now, if you're interested in finding your voice and sharing your story, I'd like to personally invite you to join our live tribe and take our 21-day challenge in our free private Facebook group. Your challenge will be to post a live 60-second video each day for 21 straight days to build skills of confidence, commitment, leadership, and accountability all while growing your network with like-minded people from around the world. You'll quickly see how turning up each day gives you more clarity, purpose, and transparency to become your best self. American Real wants to connect you with other high achievers and provide you with the tools you need to become more present and focused in valuing the power of your own story. Click on the link below to join American Real Live Tribe 21 and start your 21-day challenge today. And now, without further ado, I bring to you Dr. Matthew Regulski. This is American Real. I am Roger Brooks, and today my very special guest is Dr. Matt Regulski, foot and ankle surgeon specializing in diabetic reconstructive surgery, limb salvage, and wound healing.
Yes, sir.
Dr. Matt. Matt, my friend,
Long
welcome to the
time,
show.
Thank you. Thank you for having me. This is a great privilege.
Well,
I appreciate it.
It's an honor, and actually we're here the last couple of days to honor your mom,
Correct.
who passed, and of course we're all extremely sorry for your loss,
Right.
and we all loved your mom very much.
Sure.
It was a big part of all of our lives growing
was.
up, and so we extend our condolences to you and your family.
Thank you. It's been wonderful being here. Get to see everybody. You know, being in New Jersey, I don't get to see you guys as much as we would like to, but this has been wonderful. The outpouring, the support, the love that we feel from my mother. Been born and raised here in Binghamton. Great place to grow up, and I'm glad to be back here to talk about these problems that we're going to be discussing.
Yeah, and you know, I know we were having breakfast this morning, and we were talking about diabetes and just the immense
Sure.
problem that our epidemic that our country is facing, and really the world. And some of the things you were telling me struck me, pretty strongly, as I am trying to get the word out about a lot of different things that are affecting our world. And it sounded by your remarks that it doesn't sound like people take diabetes that serious.
You know, I coined this phrase, diabetic apathy. And I think through no fault of the patient's own, because we don't have enough public advocacy, I think. I think the American Diabetes Association does a great job, but patients who have diabetes really don't appreciate the destruction that's occurring within their body. So I coined that phrase, diabetic apathy. For instance, when you say, God forbid, you ever hear that you get the diagnosis of cancer, people say, oh my God, I got to do something right away. All these things that I got to see somebody, I got to get treatment. With diabetes, when people hear they have diabetes, they say, well, okay, I have diabetes. I feel fine. I don't see any problems with me. Nothing is going on immediately that I have to be treated for it, except diabetes kills more people than cancer does. Because it affects every system in the body. It can affect every part of your body, but it takes time for those complications to occur. I kind of liken it to a house that is full of termites. From the outside, you look great, but from the inside, you're being really eaten away because of the chronic destruction that is occurring. It takes time for those complications to build. So people think, Doc, I'm not diabetic. I take a pill. You know how many times I heard that? Or, Doc, I can eat what I want. I take a shot. Diabetes is incredibly destructive to your body. As a diabetic, if you don't take care of yourself, it will kill you slowly. Speaking from experience, my own father had diabetes. I had to cut part of his foot off because people didn't follow evidence-based medicine, and he didn't understand exactly what was going on to him. Because, they get inundated with so much information. There's so many things they have to learn, so many things they have to know, so many doctors they have to see, and so much medication they do have to take. But I think if we as advocates can get out there and get people to understand, if we just exercise a little bit more and we eat better, we can get rid of half of the diabetes that is going on now.
Wow. So break it down for us. So, the average person like me, so of course I'm familiar with diabetes. I hear the term. When I was growing up, my grandmother called it sugar.
Right. Right.
So, but what's happening inside our bodies? Why does it happen? I know there's different types. There's type 1, type 1 and 2.
Okay.
What does all that mean?
Well, diabetes in Greek means siphon. So actually what happens is when you have a type 1 diabetes, is more of an autoimmune disease. So you got inundated somehow with a virus that creates certain types of problems with the cells that make insulin in your pancreas. So usually, obviously, younger people develop that. But we're seeing a little bit of an uptick in type 1 diabetes in older people, which is a very interesting finding. Type 2 is the disease of diabetes, of obesity and inflammation that is occurring. People that are overweight, that eat excessively. They start also with this metabolic syndrome, pre-diabetes. We have 90 million pre-diabetics in this country. Hypertension, hypercholesterolemia, so elevated cholesterol. And when they get a little bit what we call truncal obesity, when your belly gets a little bit bigger than it should be, it's a little harder to put your belt on, to put your pants on, it gets a little tighter. And you notice that little sag of skin that's hanging over your belt line. So that starts the inflammation that is coursing through your body that's going to lead to that problem that's called insulin resistance. So when you build up this inflammation in your body, not only does it affect your pancreas and ability to secrete insulin, but also the bigger question is for your ability of your body to respond to insulin. Thus, insulin resistance that occurs. So your cells are not taking up sugar in your body. We think about muscle. That's why we tell diabetic people that need to exercise, because muscle is the major disposal organ for sugar in your body. So the type 2 diabetes, to go back, is more of a disease of obesity and chronic inflammation, the more predominant species. People can take a pill that are on type 2 diabetes, and people that are on type 2 diabetes can be on insulin also. So those are the two distinguishing features. Now there is some scuttlebutt about a type 2 with some subtypes to it, but for the lay people, type 1 is more a disease that is an autoimmune process. Type 2 is an inflammatory disorder.
And talk a little bit more about the muscle. So what's actually happening? The muscle helps when you exercise, right. When you're...
The problem with diabetes, you develop this thing called hyperglycemia, elevated sugar. The problem is that your body, your cells in your fat and in your muscle, they're not responsive to the action of insulin, because insulin's job is for you to lower your blood sugar, take it, put it into your muscle, put it into your fat. So the cells actually, because of inflammation will tickle the receptors on the surface of these cells and inhibit their ability to take up sugar. That's where we coined that phrase, insulin resistance. So your body does not respond to the signals of insulin to take up sugar from the bloodstream. So the sugar just rises in your bloodstream. It gets higher and it gets higher and it gets higher. And you can develop a condition called diabetic ketoacidosis, or DKA, where people get, they go into almost a shock, almost into a coma, right, because their sugar is so high. So we tell diabetics that when we talk about exercise, which is such a great feature, because not only does it cause you to uptake more sugar into the muscle, get it out of the bloodstream, bring your sugar level down, but exercise itself can upregulate enzymes that are natural antioxidants so that it can kind of extinguish the inflammation that is going on throughout your body. So that's why we want diabetic people, and people in general, who are even in that pre-metabolic phase. That's why we talk about how to get rid of that, is diet and exercise. If we exercise more, that causes that sugar to be removed from our bloodstream, put into our muscle. So muscle is the major disposal organ for sugar in our body. That's why we need people to exercise at least good 30 minutes a day.
I see. And what foods are most prevalent as far as, creating this inflammation?
Well, I think obviously that when we talk about people that eat a lot of fried foods, when you talk about red meats, when you're eating a lot, that's a lot of saturated fat. There's a lot of talk, polyunsaturated fats, saturated fats that are going on. So with saturated fats are very hard to be broken down, so to speak, in your body, right? They cause all this fat to stay lingering in your system, and it's hard for it to be disposed of. Whereas a polyunsaturated fat is easily broken down. So polyunsaturated fats, a lot of nuts, certain types of oils, canola oil, avocado oil, those good fats that we talk about people to eat. But when you look at the different types of foods that are going on, not only the fried foods and the high sweets and all the sugars and sodas, you know that it takes 4 hours of exercise to burn off 1 can of regular Coke? Wow. If you drink that. 4 hours of exercise. Think about how that is. Yeah. So I think it's also not only those types of food, but it's our portion size too, right? Some people think that they have to eat, when they get a big plate full of food, that they have to eat all of that's on their plate and clean their plate off. We need to eat till we're content. and then push the rest aside and take it home with you and eat it at a different time. But we got to watch our portion size. Am I saying that we have to give up all of those good foods? I think that, in moderation is fine. But when you're diagnosed with diabetes, you better follow a strict diet, a very strict diet. And there's multiple different types of information that people can get on diet. Not only the American Diabetes Association, but the Mediterranean diet, the DASH diet, South Beach diet. Very good anti-inflammatory, cardiovascular, healthy diets for people to follow.
So, again, when we talk about the different types of diabetes, what determines whether or not someone will need a pill versus an actual shot of insulin?
Well, I'm not an endocrinologist.
Okay.
Right. So endocrinology guys that are the medical doctors that treat that specialty. But I know a lot about the different medications. And it all depends upon sugar control. They usually start you out, when you're diagnosed with diabetes, type 2, the first line treatment is something called metformin. So metformin causes a couple of different things to happen in your body. It causes your cells to become more responsive to the insulin signal, okay? And the second thing is, when you're a type 2 diabetic, is not only, right, you get the elevated sugar, but your liver stores something called glycogen. Think of that as animal fat. And the liver then can be signaled to make excess sugar. It's called gluconeogenesis. So the metformin can also slow down the hepatic or the liver production of sugar. So that's usually the first line treatment in diabetes. And then as they also counsel patients to obviously diet and exercise as well. So the realm of moving from pill to insulin, but there are some people that are on a combination of the both. And now with all the different types of new drugs that are out there, Trulicity and these different canaflagacin, there's different types of these newer drugs that are still some injectable, but they're not insulin. But it all depends on how well people are controlling their sugar. I've seen people that have been on 2 and 3 different types of pills, 2 different types of insulin, because they're just not taking better care of themselves. They have very virulent forms of diabetes because they're still quite obese and not being able to reduce this adiposity.
Yeah, so from what I gather from what you just said, that don't just rely on the medicine. You can't take the medicine and then eat everything that you want. You have to be very careful about your diet.
Diabetes is what you eat. Like I said, how many people have told me, Doc, I'm not diabetic, I can take a pill. Or I can eat what I want, I can take a shot. If you continue with that logic, I will be cutting something off of you if you do not have a major cardiovascular event, if you do not have a major heart attack or stroke. That's a bad way of reasoning. If you don't eat better and if you don't exercise as a diabetic, you're going to have some major problems.
So I'd like to talk about your surgery, but before we go there, can we just touch about, we talked about this morning again, our youth. You rattled off some pretty disturbing statistics.
Correct.
And can you go through some of those again?
Well, we look at the obesity population, the obesity epidemic. Obesity itself leads to the inflammation that can course through your body, leading to the stimulation, the diagnosis of type 2 diabetes, and the progression to its destructive complications. In our country alone, 1 out of every 3 children is obese. In the world, it's 1 out of every 2 children is obese. If we don't find a way to reduce that, our diabetes numbers are going to go through the roof. Do you realize in this country today that 5,200 people are diagnosed with diabetes every day? Just in our wonderful country. 2030, 1 out of every 4 people in the world are going to be diabetic. Those numbers will be here in this country in 2050. Kids need to exercise more. Kids need to eat better. Listen, when I was a kid, I loved ice cream, right? You always wanted to have a soda. But at the same time, we were always outside playing. As we were kids, we were playing. We're at First Ward Park playing baseball. We're playing football, basketball, lacrosse, wrestling. We pick up games left and right? We come home from school, we're shooting baskets, we're throwing a ball around. The kids are not doing that stuff anymore. Nobody gets out and just goes out and has fun. They're all sitting playing Fortnite or doing something in the house, right? On their phones, doing things. If kids don't start exercising better, and we do not watch what they are eating, we're going to have a bigger problem. It is growing exponentially, the diagnosis of diabetes, and it all starts with the beginning of obesity because that's what creates the inflammation that leads to the progression.
Yeah. It all starts at home.
It all starts at home.
So in your field, in your day-to-day work, you are a surgeon. So I'm assuming that you're seeing people that are pretty far down the road, right, with their diabetes. Would that be fair?
That is true, but at the same time, we're getting a lot of referrals from endocrinology guys. Endocrinologist is somebody that takes care of hormones in your body. They treat ailments of glands that produce different types of hormones: thyroid, pituitary, adrenal glands, ovaries, and yes, your pancreas is an endocrine gland. An endocrine gland is something an organ that secretes a hormone that gets put into your bloodstream. So endocrinology guys now, when they get new diabetics or people that are recently diagnosed with diabetes, they're always sending them over for evaluation, because if a diabetic sees a foot and ankle guy twice a year, he saves $1 billion on the healthcare budget.
Wow.
Imagine. Right? All you got to do is see me twice a year, and I can save the healthcare budget $1 billion. Primary care physicians are doing that now. We're getting more referrals just for newly diagnosed people to look at their blood flow, look at their feet, get them into a good, nice molded sneaker so they can exercise in. So a lot more specialties are engaging that if we can start this problem now and start to educate people, we can have better outcomes. I think the problem lies in that when you're newly diagnosed with diabetes, you get a stack of information. And it's overwhelming to people. It is. When my father was diagnosed, he was just overwhelmed. He didn't know what to do, when to eat, how to eat, how much he could eat, when to take his medication, when to take this medication. It was just so overwhelming to people. So there are many avenues for people to go to. They can go to diabetes education classes that every hospital will have a diabetic educator, which is covered by insurance with a prescription. Now, they only allow so many of those a year, which I think is a little bit obtuse and short-sighted, that people should be allowed to go as much as possible because they always have questions. They don't remember. When you go to the doctor, you only remember 30% of what he says. And this is a disease that can cause major morbidity, mortality. So they always have to stay up on that. And so when I see these new patients and we examine them, we always get their blood flow checked because diabetes and vascular disease go hand in hand. I make sure they have an ophthalmologist because about 233 people every day have their legs amputated in this country. 133 people go on dialysis, kidney failure. So I make sure we do blood work. And if there's problems with their kidneys, they get sent to a nephrologist. And 55 people go blind every day in this country from diabetes.
So what's the correlation between diabetes and blindness? What is actually happening?
It's an interesting finding. It's quite a dichotomy actually, because what happens in their legs. So in their eyes, you have your retina. So you take in light signals, it hits the retina, that is transferred to the occipital cortex in the brain, and your images then are produced so that you understand what you are seeing. The problem in the eye is that they start to have growth of blood vessels. So when they have growth of blood vessels, it kind of blots out the retina. Those signals cannot get perceived to the brain, but at the same time, it's hard for those images to get on the retina because they have all of these blood vessels. So that's what we call retinopathy. But in the leg, it's interesting that we don't make enough blood vessels. They get calcified, their blood vessels. We don't have enough collateral circulation so that it can go out and around all these narrowings and all of these clotted off arteries, and thus they get gangrene. But in the eye, we're making too many blood vessels. We have too much of the signal making blood vessels in the eye, where in the leg we don't have enough of those signals to make new blood vessels. So diabetes affects every system in your body. That's why it makes it so devastating, and that's what makes it so costly. As of last year, we spent about $407 billion, with a B, $500 billion in the treatment of diabetes and its complications. It's amazing.
You're doing these reconstructive surgeries, right? As they're labeled, limb salvage, wound healing. So what are you doing day to day in this regard?
Well, we'll see.
What are some examples?
Yeah, we'll see. So, for instance, I do a lot of wound healing, and our group in New Jersey, we have several wound centers that we see. So we get people with a lot of end-stage disease that have been tried to be treated by other people who are not really a specialist in this type of field. So we'll see people with big non-healing sores, top of the foot, bottom of the foot, on the heels, on the legs.
What do they cause from?
Well, it's very interesting that you say it's a very complicated reason why they get this. But the number one reason is they can't feel. So we call that neuropathy. There's a sensory component. Now, neuropathy encompasses three aspects: sensory neuropathy, motor neuropathy, and autonomic neuropathy. Let me just talk about so people understand it. So sensory, you don't feel pain. You didn't, say for instance, you wore tight fitting shoes and you would say to yourself, boy, that's really rubbing on my feet, that's bothering me, or it's rubbing on my heel. Diabetics don't do that. So they'll be in these shoes 2, 3, 4 hours a day, and then they'll get a big blister. And then that blister, then they don't have pain, they can't feel it. That blister can then become infected. And now they still don't feel, but now they might start smelling something, or they see some kind of drainage on their sock. And by that time, now we have this big open sore that could be infected with pus coming out, bones exposed. I've seen people walk into my office with bones sticking out of their foot. But if they can't feel it, and if it doesn't hurt, then why do I have to have somebody to see me? Or at the same time, I think some people are in denial about these things. If I don't have to go see a doctor, if somebody's not trying to treat this, if I'm not paying attention to it, maybe it'll go away. I can't tell you how many people we have seen that with some infections riding up their leg, sick for weeks and weeks and not coming to see because they have been afraid that they might end up with an amputation. Well, now, if you would have came when you had that wound, when it was a little teeny thing, could have fixed that very easily. Now, you could end up with an amputation of your leg, which is incredibly destructive, and the mortality rate is through the roof for an amputation of the limb.
And how do you make that determination? What are you looking for when you say, okay, this is a tough call here?
It's very complicated in the fact that you develop it really depends upon a couple of things. So one would be that blood flow. So diabetes accelerates plaque formation inside the arteries. That's why 80 to 90% of diabetics will die from heart attack and stroke. So it's more of think about it as an injury response inside your body. You cut yourself, cells come, they clot up in there, that's your little platelets, they make a clot, then this clot is going to secrete things that are going to draw other cells to that area, they make a matrix, and then the skin cells will migrate over and they close. Well, inside an artery, diabetes from this chronic inflammation creates an injury response, but the injury response doesn't get turned off. So all these cells come inside and they clump and they clump and they clump. So inside the artery, as they start to clump and clump and clump, they close off the flow down through the lumen of the artery. And the artery starts to narrow and the artery starts to close. And now when you get no blood flow, you have a big problem because you're not getting oxygen out to the tissues, and the tissues can almost deteriorate.
And it's irreversible, right? Once that happens?
Well, it all depends. A lot of times, the vascular surgery department and the interventional guys have some tremendous modalities at hand. They all start with catheter-based procedures. They have drills, they have lasers, they have all kinds of things to get through that plaque. But make no mistake, that plaque is as hard as concrete and as sharp as glass. And if it's an extended period of time, that artery will become so calcified that they can't get through. Then they try to do a bypass procedure. But even that can be hard because now the whole vessel is calcified. Where can you find an open area that you could bypass to? So you start talking about the vascular flow. Where do we get enough oxygen to support healing? Do we just cut off the big toe? Do we have to cut off half the foot? Do we take everything off but the ankle and the heel bone? Do we have to do it below the knee? Do you have to do above the knee? We try to salvage as much as we can because the higher that you have to amputate, the lower the life expectancy will be, because diabetics just can't take the metabolic expenditure of an amputation. It's very hard for them. That's the third component of that nervous problem, is when they have autonomic neuropathy. Autonomic neuropathy means that, and it's a complicated thing, is because the arteries have to open and close depending upon need. So for instance, you don't sit there, you're playing basketball and you say, gosh, I'm going to start playing basketball hard, start pumping, get more blood flow to my brain and to my muscles and out to my heart. It's done automatically for you. Diabetics have a huge problem, is that they cannot do those things because of autonomic neuropathy. So thus that can lead to significant arrhythmias, and it can lead to a decrease in dilating arteries and getting blood flow to parts as well.
Wow.
So neuropathy is probably the leading cause of what happens and what is the genesis of the diabetic foot ulcer.
I see. So when you have an amputation, that in itself could limit your lifespan?
Well, when you have a below-the-knee amputation, about 65% of them will be dead in 3 years. Then if you go above-the-knee amputation, that's about 80%. in 3 years. If you have a minor amputation, which we talk about toes, about 18% of those could be dead in 90 days from that. A major amputation can be up to 11% in 30 days, could end up dying from that. So the more that we have to remove, unfortunately, the higher the mortality rate. That's why we try to save every piece of tissue that we can. But the longer that a diabetic waits to present themselves with their problems, then the more that we're going to have to remove from them. That is a huge problem. So I try to stress to people, check your feet every day. Look at the bottoms of your feet. Look in between the toes. If something doesn't look right, you get a red mark, you got a little black and blue hair, get in and get seen when it's little, not when it becomes a big problem, because then I can't work and do those things that I've been taught to do to help you.
And it sounds like a lot of it starts in the feet.
Well, because again, it starts with the neuropathy, and it starts with blood flow issues. Diabetic foot ulcer is the #1 reason that diabetics are admitted to the hospital. 84% of all lower extremity non-traumatic amputations were preceded by a diabetic foot ulceration. That's why we tell them, if there's any question you don't think, come in, get seen.
Right.
Who cares how small it is? Let me look at it, or one of my trained partners or professionals do it, so we can see, we can diagnose, we can treat, we can take care of it, and be done with it.
Why are so many people afraid to go to the doctor? I mean, I hear this all the time. And it doesn't seem to, discriminate based on age or anything, that people just don't like to go in.
Because I think people are afraid of finding out and fear of the unknown. When I go to the doctor, I get that white coat hypertension. I get nervous as well because I come from a long line of diabetics. I get very conscious of the fact that because I have a first-degree relative that was diabetic, I am more predisposed to doing that. But I think people are afraid. If they don't acknowledge these problems, then I don't have these problems. If I don't have to be treated, then I don't have any reason to go to the physician. But if you have diabetes, you have to see lots of physicians because there's not one person, not one physician that can treat this problem.
Because you're saying it affects so many different
organs. Affects every system in your body, head to toe.
Wow.
It's scary.
How do we get the word out about this epidemic? I know, hey, it's great to have discussions like this, but how do we continue to spread the word?
I think that we're going to have constant education and advocacy. Programs like this, so that it can always be out there for people to Google, look up, and we can start putting forth all of these different types of guidelines. I think we need to be on TV, having info commercials. Remember when we were young, they always talked about, you would see don't do drugs, things coming on TV,
sure,
right? And all that. We need to have that with diabetes because it's going to get so expensive. We're not going to have the funds anymore to treat this. $500 billion already as of last year in the treatment of diabetes and its complications. But at the same time, there has to be an onus of responsibility on the patient. You got to stop the smoking. Smoking and diabetes, guaranteed amputation. I will be cutting something off you if you do not have a heart attack or stroke. Exercise. 30 minutes a day. You can't go out and walk around the block 30 minutes a day. Get up in the morning, take a walk, or if you come home at night, there'll be a lot of patients say, I just don't have the time. I go to the gym 5:30 in the morning because it's the only time that I have to go. I don't like it, but that's the time when I have to go. You have to make time for wellness. There will never be a good time for that to occur. We all are busy. We have children. We have careers. We have things to do, but you got to make time for wellness. If you don't, then you're not going to be so well and you're going to have big problems, especially if you are diabetic.
Yeah. We were also talking about you don't necessarily have to be obese, right?
You don't. I think people have a misconception that obesity, they're going to be 300 pounds overweight in order to have it. That's not true. There's something called your ideal body weight. And, I can give you formulas of how we ideal body weight. But the fact of the matter is, if we don't exercise and if we don't eat better, we can start that very deleterious chronic inflammatory pathway that can lead to the diagnosis of type 2 diabetes. People have to exercise, we have to eat better, we have to watch what we eat, and we have to have portion control. If we don't, then you're going to have big problems. And diabetes is the last thing that you want to be diagnosed with, because it affects every system in your body. You can't cure it, but you can definitely control it if you follow that simple path of better eating and exercise and maintaining normal blood sugar levels.
Matt, if you were able to give a public service announcement to the world and you had to sum it up, what would you, if you were going on and you could just get a message out there, what would you say? And I'm looking for something that people could maybe cling on to and be able to repeat. Do you have anything come to mind?
I think that I would say that diabetes is an equal opportunity destroyer. It doesn't care what your gender is. It doesn't care what your race is. It doesn't care how wealthy you are. It doesn't care how poor you are. It doesn't care if you are black, white, green. It does not matter. It wants to destroy your body. It wants you to get tired of taking medication. It wants you to get tired of seeing other physicians, because as soon as you drop your guard, it's going to run rampant. So diabetes is a destroyer. If you do not do things to take care of yourself, you will die from it. And you will die, unfortunately, a very horrible death, because it literally will eat you alive. It's incredibly destructive. I see it every day. And that diabetic apathy that we talked about, we have to find a way to change that in patients, because there is an onus of compliancy on patients. They have to follow their regimens, they have to control their blood sugar, their blood pressure, and their cholesterol, and they do have to exercise. But there are patients that can't afford a lot of their medications. I've had patients that say, well, this month I can afford these, and next month I'll try and get those. So there has to be pathways put in place for them to get their medications. But at the same time, there's got to be a pathway for these patients to be more compliant. They got to eat better, because a lot of my diabetic people, we give them literature, I give them avenues how to find things, I give them sites to go to, and a lot of them do not follow that as well.
Yeah.
So there's going to be a tough balance there.
You talked about your dad earlier and having to do surgery on your own father. That's not heard too often. That must have been difficult.
At first, when my father was being treated for this, I was trying to give him what to do, what to ask the physician, making sure he was writing down his questions. And finally, after 6 weeks of him being treated, not with evidence-based medicine, I was very angry, because I should have probably brought him down with me sooner. I got in the car, drove the 5 hours up here, and when I finally saw him, it was not a good sight. He had lots of problems with gangrene on his foot. Nobody had done any type of Dopplers, what we call ultrasounds, to see how his blood flow was, because I was feeling for pulses in his foot, and he had no pulses in his foot. So I put him in the car, and I drove him down here to New Jersey, and I had my people. We did a complete comprehensive control. He had an occlusion of an artery, the big femoral artery here just above his knee. My vascular guys were wonderful. They went in, they ballooned it, opened it right up, got 3 vessel runoff to the foot. So in the foot, getting down to the foot, you have 3 blood vessels. That's what we talk about, 3 vessel runoff to his foot. But by that time, he had a lot of gangrene that was going on. I had to cut off half the side of his foot, part of his heel. I had to take muscles from other parts, move them down there to cover all the bones and things. And then types of skin graft, we use new stem cell grafts right now from the placenta, which are unbelievably powerful for healing. We had to use a lot of those things, and a special type of cast we call for diabetic foot ulcer called the total contact cast. So my dad stayed with me for about 4 months. It was a wonderful learning process for me to be there, and for my children to see this going on, to understand that they were young, but they were always helping him, and I think that he really enjoyed being there. And then ultimately, he was doing well, physical therapy. He did all kinds. He was back home here in Binghamton, and then, unfortunately, as a lot of diabetics did, he had a big heart attack caused by his diabetes.
I see.
So, which is what happens to a lot of these diabetic patients. All this inflammation coursing through the body, all these plaques, they can get weak from it, and the plaque will then break and can travel, stroke, heart attack, and that's what happened.
So if you could go back and talk to your 20-year-old dad and give him a message, what would you say to him?
I would say, Dad, you better lose a lot of weight and you better start exercising. Because my father he was a tall man, but he was obese when we were younger. And he did go on Weight Watchers and he lost 100 and some pounds, but then ultimately he gained it all back. And he was diagnosed with diabetes when he was 61, type 2 diabetes at that time. So if I could go back to my father and when he was 20 years old, I said, you got to eat better and you got to exercise more. Those are the two best things you can do. You can reduce that cycle, that pre-diabetes, that inflammation, if you followed those two simple regimens.
Awesome. Matt, this has been awesome. This has been an education. I don't know if there's anything else that we left out that you would like to talk about.
I would think that, I guess if I was speaking to a group of diabetic people, I could show them pictures of some horrific things that did and can happen to them. But I think the biggest thing I would tell them is, again, diabetes, you have to exercise, you have to eat better, but you need to look at your entire body. Yes, where you first see these manifestations is the lower extremity. So you need to obviously check your feet every day, bottoms, tops, in between the toes, the heels, and if there's any question that does not look right to you, anything on the lower extremity, be seen by a medical professional, because when these problems are small, they're very easily fixable. But at the same time, you have to change your lifestyle. If you don't change your lifestyle and continue down the same path that caused you to get the diagnosis of diabetes, you're going to have horrific complications.
I did have one last question as you were saying that, and that is alcohol. How does alcohol affect diabetes?
Well, it's not so much that alcohol can affect your sugar levels in your body. Alcohol can lead to hardening of tissues. That's why unfortunately, alcoholics get this cirrhosis of liver. It's hardening of the liver because it's toxic to the cells. So it creates an injury inside your body, and your body heals by scar tissue. So excessive scarring of that. But you are correct that if you drink a lot of wine has a lot of sugar in it, will raise your blood sugar levels. All alcohol does. Now, obviously, you get into your harder spirits of vodka and gin and whiskey and those. The sugar content is less, but people love wine. I enjoy a glass of red wine. But red wine itself does have some good antioxidant properties. But again, everything
moderation.
Moderation.
Yes.
Moderation and moderation.
I think that's the lesson for life, right? We have to do everything in moderation.
Everything in moderation. Do you have to cut everything off completely? But at the same time, when you're a diabetic, you have to be so diligent and so focused in your treatment plan, and you have to change your lifestyle.
Yeah.
Otherwise, you can take gallons of insulin a day, and it's not going to change the outcome, which is going to be a catastrophic event, whether it's going to be an amputation, or whether it's going to be a heart attack or stroke, or you go blind, or you go on dialysis. You've got to change your lifestyle, and you've got to exercise more.
What's next for you? What do you see in your future the next 5 to 10 years? Are there any things you want to accomplish in this field?
Well, I think my biggest thing to accomplish in this field is probably getting my patients to understand the complexity of their disease, being able to control their disease better, and for me to do less surgery. That's going to be my goal. So the less surgery I have to do, the better off my patients will be, and I know that they will be getting better. But again, it's this diabetic apathy. If we don't get over that problem of them saying, well, I don't see anything wrong with me, I feel fine, I don't have any problems right now. If we don't get over that apathetic response from patients, it's going to get quite pathetic, because they are going to have some major complications. Again, it's just like a house that has termites in it. From the outside, it may look perfectly fine, but on the inside, there is rapid and incredible devastation that is going on.
That's a good visual. That's a good analogy. And look, this has been a great conversation. I'm so glad we did this.
It's awesome.
I hope a lot of people learn from this and call their own doctors and check their feet and their legs and their bodies and make sure that, things aren't changing. And if they do, to get in as soon as possible.
And get a physical. If you haven't been to the doctor in a long time, go. Get some blood work done. You should have a physical twice a year. Over the age of 45, you should have a physical twice a year. Some simple routine blood work to look at the lipid levels in your body, look at your sugar. How is your kidneys functioning? What's the inflammation markers like in your body? Simple blood work can tell you lots of things.
Well, I'm 48. I do it once a year, so I'm glad you
Right.
told me that. I'm going to start doing it twice a year.
Especially if you have a family history of those problems. If
Yes.
you have a first-degree relative, a father, a mother, brother had these problems, you are much higher. The predilection for developing that is incredible, and you should have blood work at least twice a week.
Wow, great. Matt,
Good.
thanks so much. This
Thank
has
you.
been awesome.
This was great.
Appreciate it.
Thank you for having me.
Thanks for coming on American Real.
My pleasure.